let's follow through with what's going on with the vaccination drive in the country. And all private hospitals are now permitted to give the COVID vaccine, with states urged to utilize 100% of their capacities of private hospitals functioning as CVCs. Zahabiya Khorakiwala, the managing director of Wockhardt Hospitals, now joins in on the show to discuss that and lots more. Thank you so much for taking time out. Zahabiya, good morning, and just give us a sense as to how this move is really going to speed up the overall vaccination drive in the country and what it means for Wockhardt in particular.
Hi, good morning. Thank you very much. We have just, private hospitals have been given permission to really start from today. Since even with the COVID pandemic, the private healthcare is an integral part of India's healthcare infrastructure, and so there will definitely be greater accessibility to the vaccination at a country level with the private healthcare coming into play. As far as we are concerned, every citizen essentially needs to register themselves on the Cowin app through their documentation, one of their documentations that they need to fill in the details for. And they need to come in essentially with that very documentation which gets verified at the hospital. And then it's a fairly smooth process of vaccination, waiting for about 30 minutes post-vaccination, in case any support is required or any reactions are there.
As well have been given the green signal to vaccinate for COVID. Is the infrastructure up and ready, and would it happen with immediate effect?
So yes, we have prepared the infrastructure required, which has already been inspected. So the state authorities did come in about a couple of weeks ago to check the infrastructure, the flow of patients. That inspection happened, the approval was given. We had already started actually vaccinating our own staff about a week ago based on that approval. So the infrastructure is in place, and the logistics are in place. As we keep getting the doses from the authorities, we will be able to vaccinate people.
Sure. So how does the mechanism really work, Zahabiya? I mean, the government supplies the vaccines to you, or do you have to procure the same?
So the government supplies the vaccinations to us and replenishes the supplies as they get over. And people have to, so the money that is collected, which is 150 rupees for the actual vaccine, that is deposited in the national health account, and the 100 rupees is as a service provider that is allowed for the hospitals.
And is there a price cap? Are private hospitals going to vaccinate for free, or is it going to be that stipulated fee of 250 rupees?
It is the stipulated fee of 250. Of the 250, 150 is the cost of the vaccine, which goes to the government. And the 100 rupees is the money that the private healthcare, the hospital, is allowed to retain for the service of vaccination.
Let me listen. Okay, great. Great to have you then on the show, Zahabiya. Good to get in that clarity.